there's a good economic case for investing in the first year of life because those kids will become more productive. I don't make the economic case, I make the moral case.
I'm here this morning with Professor Sir Michael Marmot, one of the UK's leading experts on health and child poverty. And we're going to talk a little bit about some of the challenges facing children in poverty in the UK. Michael, what sorts of health concerns do you see amongst children who are living in poverty in the UK?
What we see is a social gradient, and that's why relative poverty is important. It's not just people at the bottom, but a social gradient in parenting activities. Cuddling, speaking, playing, singing, reading, all of those, quote, normal parenting activities follow the social gradient. The greater the deprivation, the more likely it is that parents will deny that it's important to do those things with children. And I don't blame parents. I blame their situation. If you ask a parent, do you read bedtime stories? Well, if I knew I had a bed, I might read bedtime stories, but we're homeless. We're living in temporary accommodation. I don't have the luxury to sit with my child and read bedtime stories. If we think about cold homes, growing up in a cold home with mold, damp, damages children's lungs, damages their mental health. Children who grow up in cold homes do less well in school. Air pollution, the more deprived the neighborhood, the higher the exposure to PM 2.5 levels. Yes. There's a good economic case for investing in the first year of life because those kids will become more productive. When I say not me, I don't make the economic case, I make the moral case. What kind of society do we want? And you know, the government we currently have in the UK, it put real emphasis on economic growth. Yeah, I mean, if it helps, yeah, but that doesn't seem to me the mark of a good society. The mark of a good society is having healthy people. Yes. And having relatively small inequalities. That a society that's socially cohesive. And damaging children doesn't lead to that kind of society.
So what can be done regionally, nationally to reduce the numbers of children living in poverty?
When the Chancellor in the first year of the pandemic upgraded universal credit, £20, £1,000 a year. Wow, if you're below the poverty line and you get an extra £20 a week, good heavens, those broken pair of trainers that your children have, you might be able to buy a new pair of trainers. And then he took it away. Overnight, 200,000 children more were thrown into poverty.
As a direct consequence
of taking it away. In 2022, 1 million children in the UK were in absolute poverty. That was a 2.5-fold increase in 5 years. Children being admitted to hospital with rickets, with scurvy, Victorian diseases. This is the impact. So we're dealing with both relative poverty and absolute poverty. What can be done, was your question. Indeed. I think there's at least 3 ways to think about it. One is reduce absolute poverty. I don't care what political stripe the government is, I'd like them to reduce child poverty, and they can do it. The government has the lever to pull. Second thing is reducing inequality. And that's not quite the same thing, because inequality matters. There was a 30-year period where average incomes didn't go up. They started to go up in the last 3 or 4 years, and inequality in the UK is bigger than in most European countries. Nearly as big as the United States, not quite. And the third is to break the link between child poverty and poor outcomes. And we've been working in Britain with local communities to break the link between child poverty and poor outcomes. So it's not as if we don't know what to do. We do. If you're renting privately, you're paying a minimum of 40% of your income on rent, if you're in the median or below of the income level. So that's a cause of child poverty. A supply of affordable housing would reduce child poverty. Give every child the best start in life, education and lifelong learning, employment and working conditions, making sure that everyone has at least the minimum income necessary for a healthy life, healthy and sustainable places, including housing, making healthy lifestyle possible, including diet, which is important for children, tackling racism, discrimination and their outcomes, and pursuing environmental sustainability and health equity together. That's what we have to do to reduce child poverty.
Save the Children, we're pressing the government in the comprehensive spending review and the child poverty strategy to be bold on reforming social security. How would reform of social security impact child poverty today and the prospects that we were talking about earlier for young people?
The Joseph Rowntree Foundation and the Trussell Trust calculated the cost of what they called essentials, which are pretty close to Joseph Rowntree Foundation's list of 6 necessities. And universal credit provides about 70% of the cost of meeting essentials. So if you're on universal credit, you'll get sick because you haven't got enough money to have a healthy life.
Not rocket science.
So it's not rocket science. So a universal credit is too miserly. If you look at unemployment benefits, if you're unemployed in Denmark, you get something like 90% of your previous salary. In the UK, it's 14% of median.
So this is why at Save the Children we're calling for the scrapping of the 2-child limit and the lifting of the benefits cap, and indeed advocating for a children's benefits lock in the same way that we've seen the success of the pensions triple lock. We're seeing people experimenting with these sorts of ideas. What kind of inspiration can we gain from these experiences, and what do we need local leaders to do to really take this forward?
First, engage local people. Figure out what they want, and ideally they become partners in whatever's happening. Second, charismatic leadership. And third, engaging people who are doing the work. Teachers, the health care people, the social care people, the voluntary and community sector, like Save the Children. The voluntary and community sector is vital. I see committed people really doing the very best that they can, and that's got to be the future.
I think that's a great note on which to close. Michael, thank you very much for sharing those insights. It's a pleasure to be working with you, and thank you so much.
My pleasure.